Frequently asked questions regarding your child's oral hygiene. Should I clean my baby's teeth? Definitely. Even before the first tooth appears, use a soft, clean cloth to wipe your baby's gums and cheeks after feeding. As soon as the first tooth appears, begin using a small, soft bristled toothbrush to clean the tooth after eating. Do not cover the brush with toothpaste. Young children tend to swallow most of the toothpaste, and swallowing too much fluoridated toothpaste can cause permanent spots on their teeth called dental fluorosis. I find brushing my child's teeth awkward. Any suggestions? It is often difficult initially to brush your child's teeth. They can really put up a struggle, screaming, kicking, crying, running away, not opening their mouths. Every kid is different. Try having your child lie down. Put your child on your lap or on the floor, keeping his/her head steady with your legs. If your child is standing, have his/her back to you with their head tilted slightly and resting against your body. Have your child hold a mirror while you brush and floss their teeth, so your child can see what is being done. Is it important to brush before bed? Yes. If you don't get rid of the bacteria and sugar that cause cavities, they have all night to harm your child's tooth. Therefore, it is important to brush before bedtime.